In this video, we're going to look at lots and lots of ways that the NHS has used social media to great effect, and there really are lots of lovely examples out there. We're going to look at some quite huge things, some things that have had a real significant national effect, but we're also going to look at lots of day-to-day, quite ordinary things that have been done online that have also had a great impact that you could potentially use too in your daily lives. So let's get cracking. First of all, I'm just going to run through the different tools that we've got at our disposal and how they've been used, just so you can see an example of each of the key tools in action. So first up, we're going to look at Twitter, and in particular, we're going to look at the @NHS account. It's an account I personally really love, and I was lucky enough to be involved right at the beginning of the formation of this account in a very, very small way, I must add. But nevertheless, this account basically gives patients and staff control of the @NHS account for a week at a time. So one week you might have a patient telling their story for the week. The next week you might have a member of staff sharing their story. And it gives you a really great way to get behind the scenes and to hear what is really going on, how the NHS really impacts upon patients and staff. And it's just a really powerful account. Really simple idea, really simple execution. But when you combine those things, they can have a great impact. So a nice, simple way to use Twitter to really great effect. Next up, we're going to look at Facebook. And now Facebook, most people think about for external promotion, external communication. And of course, there's lots of great examples for that. But the one example I wanted to share with you was how Facebook can be used for internal communications. And in particular, the London Ambulance Service have a closed Facebook group where their staff can join and staff can receive important information, can comment on key issues, etc. Now that really works for them because of course the London Ambulance Service staff are out on the road a lot, they're all over the place, it's very hard to get them all in one place. So Facebook can be a great tool for people to connect with each other. And when we think about it, acute organisations, community organisations that do suffer from the same issue, whereby staff are all over the place in lots of different locations and bringing them together in one place or asking them to read emails or asking them to go on the intranet can be difficult. So something like Facebook can be used as a great tool to bring lots of people together in one place. And through private Facebook groups, you could potentially do some great work with internal communications. And in fact, London Ambulance Service have won awards for their work in this area. So that's another way we could potentially use social media. Next up, we'll look at LinkedIn. Now, of course, LinkedIn is primarily used for recruitment. And you will see there a staggering 66,686 jobs are currently posted on LinkedIn. And that's what we primarily think of when we think of LinkedIn. And lots of NHS trusts are using it in that way. So if you've got a particularly hard to fill post in your area, maybe look at LinkedIn, maybe approach your recruitment teams to think about how you could use LinkedIn more effectively to target those groups. But definitely LinkedIn is great for recruitment. Next, we're going to look at Instagram. And Instagram, as we've talked about previously, is a really visual site. It's all about images and videos. And that's why it really lends itself to delivering great campaigns, great promotional campaigns, great campaigns that really engage. NHS Blood and Transport use Instagram brilliantly for lots of their campaigns. And here's one of their latest ones on the screen. And it's just a great way to get those powerful, impactful images out there and encourage people to share those and like those. So Instagram can be good on a day-to-day basis to be sharing great images and videos. Next up, we've got Snapchat. And Snapchat is actually rarely used by NHS organisations, but it can be really powerful. And as we talked about previously, particularly with engaging with younger audiences. And it was used to really great effect in Leeds when it came to raising awareness of mental health. And what they did was they created filters. Now, filters are basically things that sit over the top of images to add another dimension to those images. They're very, very popular on Snapchat. So what you would do is you would take a selfie and you would then overlay a filter. And what they did in Leeds was they created 6 filters that were all around mental health. And so people could take their pictures and select one of these mental health filters and then send them on to their friends. And that's how they really help to raise awareness of that cause amongst younger people. So as I've said previously, Snapchat is a bit of an untapped resource, but there are some great things that you could be doing with it. Next up, Pinterest. And one use that I've really loved about Pinterest, and this happened quite a few years ago now, was one organisation decided that on their elderly care wards, they wanted to create a little bit of nostalgia for the people that were in and staying overnight. So what they did was they created a pin board on Pinterest, and they pinned lots and lots of images, lots of nostalgic images from the 40s and 50s that they could then show to their patients on an iPad, and they could kind of flick through and see all these nostalgic images. And it was a really, really great tool to improve the experience of those patients. And what they actually did was they coupled that with a Spotify playlist. And on the Spotify playlist, they had, again, music from the 40s and 50s. And when those two combined, the Spotify playlist and the Pinterest board, you can imagine the joy that that brought to those patients. So not everything about social media needs to be about communication and engagement. It can be about improving the experience of our service users. Next up, YouTube has its obvious uses. It's there to share videos. And there are a growing number of videos on there related to the NHS, but not as many as I would personally like to see. This is one of the most popular ones you can see in front of you. This is for the NHS Go app. I show this in a lot of the workshops that I run, and I personally really don't like the video. It's too fast-paced for me. There's too many people talking. However, I'm not the target audience for that video. They're targeting younger people, and for them, it clearly does work. And so that's a really important part as we work through this social media course, to think about the fact that not all content is going to lend itself to every audience. If you're trying to target young people, then something like this, a video like this, might work. If you're going to target older people, then this probably wouldn't. So we need to think about how the content and the posts that we're putting out on these social media sites, how they appeal to our audiences too. And of course, we're not just limited to the big 7 in terms of how we can use social media to great effect. This was a campaign that was run on Tinder a few years ago by NHS Blood and Organ Donation. And what they did was they got a number of familiar faces, celebrities, if you will, to go onto the accounts and create Tinder accounts. And unfortunately for some people, you couldn't actually date these people. But what you could do is it obviously gained your attention, and you could see what they had to say about organ donation. And it was designed to get people's attention and raise awareness of that. And it was incredibly successful at doing that. So there's kind of just how you might use the individual tools. But what you can do is bring all of those tools together to create some kind of really huge campaigns and build up that momentum. And there have been some huge things that have been achieved by the NHS, some quite remarkable things. And the first one, I'm a bit of a fanboy of NHS Blood and Transport, because this is another example from them. But this for me is probably the best social media campaign that I've certainly seen related to healthcare. It's quite remarkable. And what they did was they thought, we're short of certain types of blood. We want to encourage more people to donate. So we need to raise awareness of the fact that we don't have enough of certain types. So what they did was they orchestrated a campaign where they got lots and lots of brands to remove the letters of blood types from their names. So as you can see in front of you, you've got something like Coca-Cola removing all the O's and the A's from the name Coca-Cola. Google there have also done it. They removed the O's from their names. And in the end, they actually got 1,000, in fact more than 1,000 brands to remove those letters from their names. And by getting all those brands involved, it went global incredibly quickly. You can see in the top left there, Sydney Opera House even got involved. And more to the point, through these brands and through this increased awareness, individuals and service users were doing it to their own names. For example, on their Twitter accounts, they were removing the letters from their Twitter usernames. So it really did go crazy and was hugely successful. So successful that they actually generated 30,000 new sign-ups, new registrations for blood donation within 10 days. On the second day of the campaign, they had 1,000% more traffic on their website. So it was a really, really well planned, well orchestrated campaign. It did cost money. Some of the campaigns you're about to hear about didn't cost money at all. It did cost money, and it was a significant amount of money, but actually, when you can generate results like that, it's so worth the investment. So the next campaign that I always like to share is NHS Change Day, because that really was kind of a social media movement to encourage people to pledge changes, improvements they were going to make to their daily lives. And that grew from strength to strength over a number of years, and it was all about getting staff engaged to understand what was going on and to, as I say, make those pledges. And by the end, in 2016, they actually had almost 500,000 pledges from staff to make improvements to their daily lives. And what started out as a really simple, small campaign snowballed rapidly to create real great movement for improving healthcare. A really powerful campaign, really impressive work by a number of really great people. Next up is a smaller, more niche campaign, but nevertheless a really impressive one. This is called End PJ Paralysis. Now, End PJ Paralysis, for anyone that doesn't know, is all about getting patients out of bed. When they're in hospital, get them out of bed, get them dressed, get them sitting up in a chair, so they're not kind of playing the patient when they don't need to be. And there are many positive outcomes associated with doing that. So this campaign, End PJ Paralysis, sprung up as a driver for that. And I think the key to this was the simplicity of the concept and also the way that it was demonstrated and executed and lived, if you like. So here you've got Professor Brian Dolan, who's been absolutely instrumental in this campaign. And he's giving a lecture to 100 or so NHS staff. And he's actually wearing his pyjamas to do that. And you can imagine how popular the content then is when it goes out on social media to see a professor in his pyjamas really living the values of his campaign. And this has gone from strength to strength. It's reached millions of people worldwide, and it will continue to grow, I am sure. Next up, we've got NHS Million. Now, this is not an official NHS campaign, but it is run by NHS staff. And you might be wondering why there's a picture of Katy Perry there. I will come on to that in just a second. But NHS Million exists to spread good news and share good news stories about the NHS and raise awareness of key issues that are affecting the health service. This all sprung up a few years ago following a search on Google that found that of the top 100 news stories, only 3 of them about the NHS were positive. And so this campaign started off to celebrate the NHS and celebrate the staff and serve to give a bit of a boost to morale. And this campaign has grown rapidly. It's now got around about 375,000 followers on Twitter, more on Instagram, more on Facebook. And it's grown so big that in fact in 2017 it generated more retweets than Katy Perry. Now Katy Perry is the most followed person in the world on Twitter, and yet NHS Million were able to generate more retweets than her in a year. So it shows the power of the NHS to create engagement and to create momentum online. Next up, we've got NHS for Christmas #1. This was a campaign that I was fortunate enough to lead back in 2015. And this was a campaign with very similar aims to NHS Million. We wanted to give people a little boost, a little lift in morale at a time when people desperately needed it. So myself, a doctor called Katie Rogerson, who's a paediatrician, and another doctor called Harriet Nerva joined forces to make this campaign happen. And it all started with a Facebook event, a simple Facebook event, a virtual event that we invited people to join and invite their friends to join. And within 2 weeks, we had over 150,000 people had joined our event and another 1.5 million ready to join. And that was the basis from which all the other successes of the campaign were able to come from. And we ended up getting that #1 on Christmas Day 2015, raising £300,000 for charity. And there were lots of other great outcomes, but the whole point of it was to give staff that little lift on Christmas Day. And it all started through social media. I couldn't speak about effective social media campaigns without talking about what I believe to be the best social media campaign for the NHS that is out there. And that is Hello, My Name Is, started by the late, great Dr. Kate Granger. And I think for me, again, the simplicity of the concept, the clarity of the concept is really, really spot on. The ease with which people can use it and adopt it is absolutely spot on. And I've shown lots of images here of people actually getting behind the campaign, and that is another massive strength. The ability for other people in the NHS to show their commitment to the cause and in turn raise awareness of Hello, My Name Is amongst many other people. And I don't go to many organisations now that are not actively adopting and promoting Hello, My Name Is as a concept. So out of, again, a very, very small idea with really quite neat execution, Kate created this absolute juggernaut that ultimately is improving people's lives. Social media doesn't have to just be about, as I say, promotion or engagement or communication. Social media has the potential, the ability to transform lives. And this is an absolutely wonderful example of that in practice. So those are kind of massive campaigns that have generated kind of national, huge success. But social media doesn't have to operate in that way. There's lots and lots of ways to generate success on a smaller, more local level. And the most obvious one of those is just to share positive news, a constant flow of positive news through your channels, because there is not enough of it going around. And people online really do like to read it. We're not so fond of constant negativity, and that's what we tend to get in the media. We like to have that broken up with really great news stories. So any positive news that you've got about your service, about your department, about your organisation, let's get it out there and tell people about it. The second kind of simple way to use social media that is often quite overlooked is just to connect with allies. Connect with people that might be able to help you spread awareness, engage, communicate. And that could be celebrities. There are so many celebrities out there that love the NHS that would be only too willing to help organisations with their causes. But it doesn't have to be celebrities. It could be councillors, it could be MPs, it could be just stakeholders in other organisations like Healthwatch and so on. But social media offers us the opportunity to really connect with people and connect with people that can help us with what it is we're trying to do online. I definitely look to do that as much as possible. Number 3, we've already talked about internal communications via Facebook, but there's a great way for us to connect on a day-to-day basis. I put WhatsApp there as the example. I'm sure lots of us now have groups on WhatsApp where we can communicate with the rest of our team, but it might be that we could use other tools, things like Slack, to kind of project manage as teams, or any other number. There's lots and lots of tools out there to help us connect with our colleagues online. I think social media is a great tool to connect with those that work with us. Again, really straightforward to do is to share key information and use that to get it out via our social media channels. Things like stroke campaigns, really powerful content that then can be shared by other people, and that type of stuff then can spread like wildfire. So any good visuals, any good videos, that how you communicate that key information is going to likely have the most impressive results. And it might be things like choose well campaigns, flu vaccinations, and so on that you can be putting out by those channels. But like I say, have a think about how you can communicate those in the most effective and shareable ways. The other thing that I'd recommend that not a lot of trusts do is that if you've got a campaign that you're looking to promote, get all of your staff behind it. Send emails to all of your staff and say, look, we've got this great campaign. Here's some of the images that we want to get out there. Please share them on your Instagram, Facebook, Twitter, etc. And let's help spread the word, because most of your organizations are going to have thousands of staff. And if they start spreading the word on your behalf, then you can have a really, really powerful piece of content or series of pieces of content on your hands. Number 5 is all about engagement, engaging with your community and showing that you're at the heart of your local population. And it could be by little selfie campaigns, it could be by showing yourselves at events, it could just be about asking people questions, answering questions online, being part of local community groups, whatever it might be. Social media has a great way for you to position yourselves at the heart of your community and to really engage with those that might not be your service users right now, but might well be in the future. So engagement is really, really key and can be done on a daily basis. Along a similar line is the notion of delivering customer service through social media. And I'll just put one example. I'll put our own example, that NHS Elect example, because I didn't want to pick out a trust, an individual trust. Very, very basic example. We've got someone here that didn't know where they needed to go for a conference, so we've responded to them, and then they're happy with that response. But the key thing here is to be responsive. So you can't see it just here, but actually the initial query was raised at 7:52, and you can see there by 8:50 we had responded. I can take no glory for that. It was one of my colleagues, Sue, that did that. But then, the responsiveness is what creates that good customer service. Not only have we provided the right information, but not only have we answered the query, we've done it in a timely and professional way. And that's at the core of good customer service on social media. But in order to do that, you need to be mindful and know where to find potential queries and make sure you have processes in place to answer those in a timely way. But customer service is growing on social media, particularly for the NHS. When I worked in an acute organisation a few years ago, we'd probably get 2 or 3 queries per day at a max. And now when I speak to organisations, we're getting over 10 to 15, 20 queries potentially. So it is a growing thing, and we need to be mindful about how we're going to manage customer service via social media. Number 7 is to join and create communities. Now, it might be that you want to create your own network of people and bring people together around a certain topic. For example, it might be to bring people, family nurse partnership members, bring all those people together, create a maternity focus group, bring lots of people together within the Facebook group online. But it might be more easy for you to just tap into the existing groups and be a member of those existing groups and participate within those communities. So I put the example on the screen here, Diabetes UK. If you've got some issues around diabetes or your service, or you want to find out more, or you want to find out whether an improvement you're planning to make is going to work, why not put something out on this group? Why not answer questions within this group? And that's how groups and pages work really, really well. Is not necessarily for you to create them yourselves, although you're welcome to, but to go and actively participate in existing groups and pages that are relevant to your cause. We talked about recruitment at length in this video already, but just to reiterate, social media really is a great tool for recruitment. And it's important to think about recruitment not just in terms of LinkedIn and posting jobs on there, but also how do you catch the attention of people through other platforms? How do you demonstrate your employer brand through other platforms and demonstrate to people how great it is to work at your organisation? And I put this example here because I thought it was a really neat, integrated way to think about recruitment through social media, and to actually not just have a LinkedIn account, but to have accounts on all the major platforms and to really bring those together to show how serious they are about recruiting via social media. So definitely a tool for recruitment and not just about LinkedIn. Number 9, social media can obviously be used to promote services. And I put the example here of smoke free. The reason I put this here is because this is one of the images that after 15 years finally convinced me to give up smoking. So promotion through these types of images, these types of campaigns, we all know they really do work. So if we can use social media to reach and get these images out to more and more people, then why not? And again, that can be done cheaply, easily, quickly, on a daily basis through these accounts. And last but not least, you can use social media to motivate people, to persuade people to do what it is that you need them to do. Now, I can't show you a video now, but what I want you to do is to go and watch this video on YouTube. It's called Hand Washing Gangnam Style, and it's one of the most popular NHS videos that there is, and it's brilliant. 40 seconds of joy, of fun, but it has a really important message about how to wash your hands properly, and it has a really important message about the impact that hand hygiene has. And it also shows off the organisation as fun, engaging, innovative. So we can do all those things in just a 40-second video. So video content can be really great, and we can use social media to persuade people and motivate people to do what it is we want them to do if our content is right. So there's lots and lots of ways that social media has been used by the NHS to really great effect. Some stuff is massive, some stuff is all about having really strong integrated campaigns, but there's lots of stuff you could be doing on a day-to-day basis that can have an impact and can improve the quality of care that we give our patients and staff for that matter. So I urge you to go have a real good think about what it is that you would like to achieve through social media.